Hi everyone, I am Dr. Andi. It is time for today's Facebook Live, always my favorite day of the week, where I get to share information, provide a little bit of education. I'm going to give a brief introduction to myself as I give all of you the opportunity to log on and join today. So my name is Dr. Andi. I'm a naturopathic physician. I have been practicing in Toronto, Canada for over 10 years now. I'm an educational specialist for Prove It, so my role is to provide some background information for you about ketones, ketogenic diet, exogenous ketones, and really how I apply it in practice. In practice, I have a really big focus on hormones, men and women's health, hormone replacement, anywhere from teens to menopause, postmenopausal. We deal with a lot of chronic illness as well, Lyme disease, chronic fatigue, fibromyalgia, chronic pain, and then we also deal quite a bit with preventing and reversing Alzheimer's and cognitive decline. And so at the foundation and at the root of all of our protocols and our care really is that low carb keto lifestyle. So ketogenic diet and exogenous ketones are something that we incorporate quite regularly in really all of those aspects of our practice. So I am going to dive in. I know I will try to get to all of your questions. I don't always make it to all of your questions, but I will try and answer. So I want to dive in to get to as many as I can. First, I want to start off with the reboot. I would love to hear your experiences with the reboot so far. It is available to purchase again. I just finished a month of sort of a detox, a dry January, very clean, lots of movement and exercise. So I will be engaging the reboot as well, just to sort of finish that whole detox month as well. So feel free to ask some questions if you've got questions about the reboot, when to do it, why, or how that might be beneficial for you as well. So let me start launching into some of your questions. I can see your questions coming in already. Do you need to drink Protone or protein shakes even if you don't work out? So good question. And so it depends on your overall diet. So we associate protein shakes very much with fitness. You see a lot of bodybuilders that are drinking a lot of protein shakes. They're often drinking more than you really need. And so it depends on your food intake. So for example, if you're a vegetarian or vegan, then yes, absolutely, you need to be taking a protein shake of some kind. So then I would absolutely add that into your diet. But most people aren't getting enough protein in their diet anyway. There's often this fear now that we're going to overconsume. You're probably not going to overconsume. Most people do need to get a little bit more protein in their diet. Protein is not just associated with weight training. And so I would say it's perfectly safe and a good idea for you to take even if you're not lifting heavy weights or if you're not working out. Who should take the Fueled by Female? So I get lots of questions on the Fueled by Female, and I have to say that one of my favorite ingredients is the addition of the vitamin D. And so I would say, especially in people who are living in colder climates and in the winter months, that's something you definitely want to add in to make sure you're getting really high dose vitamin D. So there's some additional vitamins and nutrients in there as well. Some licorice as well, which is a nice adaptogen if you're experiencing any period of stress, which most people are coming off of these last 2 years. So those are some really great times that I would introduce it. But again, it's safe for most people to take because most people need the vitamin D year round. Most people can use some of that additional licorice year round as well. So if that's something that you're looking to address, then I would add that. I would just sort of add that into your routine. And not worry sort of that if you might be getting too much vitamin D. Most people are not. Are there any other products I should order along with my ketones? So yes, if you've just started your ketones, you're doing your new 10-day challenge, that's fantastic. So if you're just starting drinking ketones, I would probably also get MITO. And so if you're just starting and you're kind of getting your feet wet, you're seeing how your body's adjusting to everything, I would add in the MITO. MITO is, they're electrolytes, and I usually have people just add them right into their ketones and drink them together. So if there's one other product I would suggest, it would be the MITO. Use those two to start. You can mix them together, take them at the same time, and really that would be the best way to get started. As someone who has low hormone levels and you're in perimenopause, how would exogenous ketones help? So there's some really interesting research looking at the role of beta-hydroxybutyrate and menopause. Perimenopause is interesting because it can span 5, 10, 15 years. So a woman can go into perimenopause when she's 40 and be in that state until she goes into menopause, which might not be until she's 50 or 55. So you're having some really serious hormone fluctuations in that time. But as women, as we transition towards menopause, we naturally become more prone to weight gain, to high cortisol levels, to insulin resistance, high stress. We're more prone to, again, cardiovascular disease. These are all things that women suffer from or are more likely to suffer from as they move into menopause. And beta-hydroxybutyrate has been shown to be of benefit in some of those instances. So we know that beta-hydroxybutyrate has been shown to assist in fat burning. There's a role that BHB is playing on our nervous system. So it brings down or it calms the nervous system and helps move us from sympathetic into our parasympathetic state. And so there's a role there that it could play in our cortisol as well, because when we're in sympathetic, we're spiking cortisol. Cortisol is a storage hormone. It tells our body to store fat, specifically around the middle. That's often why women in menopause and perimenopause really struggle to lose weight. This is the period of time where women are coming into the office saying, I don't get it. I'm doing all the things, I'm exercising, I'm eating, and I'm not losing any weight. And I've said it a million times, that's because weight loss is hormonal. And so there's some hormonal things that are happening there, again, with cortisol that are impeding weight loss. The other is the insulin, because you're more prone to insulin resistance and higher insulin levels, which can also lead to weight gain as well. So there could be some benefit from some of the other underlying factors that are happening while you're in perimenopause and then transitioning into menopause. What is the reason someone would get a toe cramp when adding a MITO PLEX when you're drinking 1 packet of NAT and 90 to 100 ounces of water a day? That's a great question. My suggestion might be, if you're getting a toe cramp, the question would obviously be, is it sort of muscle cramping that you're experiencing? If it is muscle cramping you're experiencing, I would actually add more MITO PLEX to what you're taking, just to get a bit more of that electrolyte in. So just to get more of those electrolytes in, I'm getting lots of electrolyte questions today. Is there an advantage to drinking MITO PLEX in your water, not in your ketones, if you're holding water? Yes, absolutely. So I'll come back to the toe and the toe cramping. So there's nothing that should really be causing toe cramping. I would wonder if somebody is maybe are you prone to stones or gout or anything like that? Maybe you're actually needing a little bit more potassium. So that could possibly be what you're needing if you're experiencing some cramping. So it might be that you just need a bit more electrolytes, but I think you'd probably have to get some blood work done and really confirm, because there's nothing in the MITO PLEX that should actually cause cramping in any way. And then the question about retaining water. So yes, I would absolutely encourage drinking MITO PLEX and electrolytes if you're retaining water. Often retention of water can be a sign of dehydration. I know it sounds a little bit counterintuitive, but just the way that the fluids move between our cells, sometimes that can be caused due to dehydration. So I would add in more MITO PLEX. But I would also check with your doctor, because there are a lot of things that can contribute to swelling and water retention. So we just want to make sure that there's nothing else going on. I have thyroid issues and have trouble losing weight. What do you suggest I do beside ketones and MITO PLEX? Oh, that's a big question. I don't know if I could actually answer that whole question for you. There are so many things that can help address thyroid issues. Depends what the thyroid issues are. Diet is a really big thing. Sometimes you need hormone support to support thyroid function. One of the biggest things I always say when it comes to thyroid is to make sure that you're with a provider who is looking at your blood work and not just looking for normal, but they're looking for optimal. So a lot of people will come in and say, I know there's something off with my thyroid, but everyone says my blood work is normal. But I don't just want my patients to be normal, I want them to be optimal. And so make sure you're with a doctor who's looking for optimal within a blood range, and not just saying, well, you're 1 point above deficient, so you're fine. We want to make sure that you're in a range that's optimizing health, not just preventing disease. So that's really important. But a lot of things for thyroid, I wish I could say it's one thing, but lifestyle, diet, sleep, stress, toxins, do you have underlying mold? All of those things can impact thyroid function. So it's a big question, but so many options. So don't be discouraged if you are having some thyroid issues and you feel stuck. Tons of options for you to explore to really improve health of your thyroid, in addition to your ketones as well. So another question is, it better to drink ketones before or after a workout? I usually like drinking ketones before a workout. I like to use the ketones as a fuel for my workout. So I want the ketones, I want to drink them, 30 to 60 minutes before my workout so it can actually fuel my exercise. So my preference is to actually drink the ketones before a workout. Could MITO-PLEX cause stomach upset? It doesn't usually, no. Lots of MITO-PLEX questions again, and how many should you take per day? So MITO-PLEX doesn't usually cause stomach issues. No, that's not a common side effect. But my answer usually when somebody asks me, can me taking this cause this outcome? It's always possible. Even if 95% of people who take something will tend to respond in one way, there's always a 5% of the population will respond differently. So would that be a normal outcome? No, it's not something that's generally a side effect. Could it be causing stomach upset for you? Absolutely. We can all be sensitive to different things. So I would say that that's not a likely side effect. I would say it's not a likely side effect. I would say to make sure you've kind of pinpointed and that you know that is what is causing the stomach upset specifically. And then see if you can make some adjustments from there. So really dig a little bit deeper, find out if that's really at the root, but it's not a common side effect, no. How many MITO-PLEX per day? MITO-PLEX, so really you can take quite a few MITO-PLEX, 2 a day, 3 a day. You can take quite a bit. Most of us are dehydrated. So you can take more than 1 a day, absolutely. Why is weight gain beginning? I might need a little bit more clarity on that question. I don't know if that's that you're just starting to gain weight in general or that you're taking ketones and gaining weight. I will say that one of the things that I do see quite regularly when somebody is initially trying to transition to a more keto lifestyle, ketogenic diet and lifestyle it's a high fat, moderate protein, low carbohydrate diet. We hear a lot about eating, lots of avocados and oils, and you read online and it's bacon and cream. And so what I often find that people are doing is that they're adding in all the oils and the fats and the bacon and the cream, but they're not cutting out the carbs. And so now your diet is high fat and high carb, and you will absolutely gain weight on that diet. So that's an error that I see some people make when they're initially starting to transition. They're trying to get more fats in their diet, but they're not cutting the carbs out of the diet. So it's a perfect recipe for weight gain. Also, if you're overdoing the fats, you can absolutely overdo the fats. Someone who's eating like a whole bucket of cashews, or, you're eating peanut butter or nut butters, by the tablespoon, you can absolutely gain weight if you do that. So you do have to be aware of what you're consuming in your day, even though we know that the fats are good for you. So I would say just to be cautious of what you're, just be aware and sort of cautious of what you're consuming. I'm actually going to tie this question into weight loss as well. We get that question. I've seen a few weight loss questions as well. So I'm just going to tie that into the overall weight loss, the weight loss topic. And I touched on it a bit earlier, saying that weight loss is hormonal, but there are so many other things that contribute to weight loss or weight gain: microbiome, thyroid function, hormones, if you're moving into menopause or andropause. These are all things that will contribute to weight gain. Stress, poor sleep, all of those things can cause weight gain. So it's important to look at the diet and the lifestyle factors as well and see if there are some changes that can be made there. How do ketones help anxiety? So there's some really interesting research looking at the role of beta-hydroxybutyrate and the role that it plays on our neurotransmitters, specifically GABA and serotonin. We know most of our serotonin is made in our gut. Any type of leaky gut or unhealthy gut disrupts the serotonin production. Serotonin is a neurotransmitter very highly correlated with anxiety. And so when we see low serotonin levels, that's often where we might see a little bit of anxiety in a patient as well. And so really healing the gut can be quite helpful, because if the gut's not healed, we're not making adequate serotonin levels. The other thing we've noticed with beta-hydroxybutyrate is that BHB can actually help convert glutamate into GABA. GABA is a very calming neurotransmitter. I've often given GABA to patients who have panic attacks for anxiety, for example, or anxiety that's not allowing them to sleep. It's very calming to the nervous system, and so beta-hydroxybutyrate encourages the production of GABA, which is why we may see some impact on mental health. So there's some really great research going on in that space right now, looking at the role of beta-hydroxybutyrate, anxiety, depression, PTSD. So some great research to keep your eye out for. Do ketones break a fast? So technically, no. I allow my patients to have ketones during their fasting window. The reason is because when we look at the history of fasting, what the studies are showing is that the benefits we're observing from fasting is likely due to the production of ketones. So what we're doing when we're fasting is trying to encourage the body to produce ketones. So by taking ketones in your fasting window, you're encouraging what we're trying to get our body to do in the first place. So I do allow my patients to have ketones in that fasting window. Do ketones help to burn fat? So there actually is some research showing that beta-hydroxybutyrate does actually help with fat loss. So there is some research showing that the BHB will assist with fat loss. I know we've seen a lot of people share their stories just starting to take ketones, and they've experienced some really significant fat loss when they do that. And there is research that shows that BHB will assist in fat loss or fat burning. Once in ketosis, how long do you stay that way? So that depends. It depends on how quickly your body is going to use the ketones. It depends on what your body needs. So for example, if you take your ketones as a pre-fuel and then you're going to work out, then it's going to be in your system longer because your body is going to use it for fuel. And so you'll probably only be in ketosis. You'll be in ketosis for a shorter period of time. However, it depends on how quickly your body uses those ketones. But generally, you're looking at maybe a 2 to 4 hour window. That's why I usually encourage my patients to take it twice, depending on what our outcome is. If there's a therapeutic outcome, I like them to take it more than once a day. So if you can take it once a day, that's great because then you get a higher blood ketone level. You get a higher blood ketone level throughout the day. So what is the effect of drinking ketones and PCOS? Lots of questions about ketones and PCOS. I always get that question. So PCOS, polycystic ovarian syndrome, is where we develop multiple cysts on the ovaries. And what we see underlying people with PCOS is insulin resistance. So they're more prone to weight gain, although not always. That's not necessarily the case for all women who do have PCOS. So they become insulin resistant. They tend to have high androgen or testosterone levels. Irregular cycles is another one. Often they have anovulatory cycles, so they're not ovulating. And so some research is showing that beta-hydroxybutyrate is actually encouraging ovulatory cycles. So it's and this is in animal studies, encouraging ovulation. It's showing that it's helping to bring down those testosterone levels. But interestingly, it's bringing down the testosterone levels that are abnormally elevated in women with PCOS, but it's not lowering testosterone levels in people who have healthy testosterone or in men. So it seems to have an impact on those testosterone levels in women who, or in those individuals who do have those high levels of testosterone, but it's not lowering normal hormone levels. And then we know the impact that beta-hydroxybutyrate might have on insulin and insulin sensitivity, and you're more prone to insulin sensitivity when you do have PCOS as well. So we see some benefit. We also could see some potential benefit there. In this instance, though, anytime that there is an underlying condition like that, I'm also encouraging all my patients to make dietary changes. The best lifestyle or diet for somebody who suffers from PCOS is a ketogenic diet. So I'm encouraging all those patients always to begin following a keto diet as well. So questions about lupus. So I'm going to actually wrap that into just autoimmune, into autoimmune as well. And actually, I'm going to come back to autoimmune because I just saw a question. Can you get into ketosis by foods you eat? And so Donna, yes, absolutely you can. And it's funny you mentioned that. I actually got into a debate with, and I think I've shared this story before. It was a professor who trained at Harvard who told me it was impossible to get into ketosis through diet alone, which was shocking when we had that conversation because that's the whole point of the ketogenic diet. And so he was saying that the only way you could get into ketosis naturally is if you were starving. And we know that that's not true. You can absolutely transition into nutritional ketosis through diet and foods. It's just a matter of changing the ratio of your foods. So again, the ketogenic diet is high fat, moderate protein, low carbohydrate. If you cut your carbohydrates down, we usually start at about 20 grams to get somebody into nutritional ketosis. And then depending on your lifestyle, if you're active, you can have a little bit more. Some people who are very insulin resistant need to have less than that. Athletes, for example, might be able to have 50 or 60 grams and still stay in ketosis because they're just burning it off so quickly. So yes, absolutely, you can get into ketosis through diet. It is more challenging, which is the benefit of exogenous ketones, which allows you to have elevated blood ketone levels as if you're in nutritional ketosis, even if you don't make those diet changes. But of course, I'm always encouraging my patients to make those diet changes. Should I see results when combining ketones, intermittent fasting, and someone with PCOS? Yes, absolutely. Ketones fasting is great as well for PCOS. We know that intermittent fasting is what allows us to bring those insulin levels down. You have to make sure you're doing at least a 16-hour fast, but the sweet spot for insulin is between 18 and 24 hours. So if you do have PCOS, the way I'm usually encouraging my patients to do their fasting is 16 hours every day, so from dinner until the first meal the next day, once a week, 24 hours, and then once a month, a reboot. If you're able, and that's something I have my patients slowly work up to. I always start them with a 16-hour. Even for the patients, if you're very carb dependent, and given that we're actually coming up to a reboot, this is a great way to prep for a reboot, because if you're somebody who is very carb dependent, you might not feel great when you do a reboot. And some people can't even do the 16-hour fast. They feel horrible. They become really hypoglycemic. They become shaky. They just can't fast. And so you have to, and what that tells us is your body is very dependent on carbohydrates. And so you have to give a really slow transition where you slowly start to teach your body that you don't need all these carbohydrates to function. And so for some people, I'm having them fast even just 10 hours to start. And then we do 10 hours, 2 to 4 weeks. And then we move up to 12 hours. We know the sweet spot is 16, and then extending is even better. But if you can't last 16 hours, then we shorten it and we do a slow progression up. So those of you who are considering the reboot, if you've never fasted before, I do encourage intermittent fasting leading up to the reboot, just so you get a sense of how your body's going to respond when you do a more sort of prolonged fast in that way. So that's a really great way to prep yourself for the reboot. But coming back to your question, yes, absolutely. The ketones and fasting would be great for PCOS. And again, that's something I'm recommending. Fasting, keto, exogenous ketones, I'm recommending that all the time, just as the foundation for PCOS. There's some other things as well, because you're estrogen dominant, so there's some other things you have to do as well, but that's really the foundation to healing if you do have PCOS. Why do I have to buy... So if you want to buy a starter, okay, so you're asking how to start. So I answered that question a little bit earlier. The question about, somebody was asking, they're new, what else do they need to buy? So I suggested buying the ketones, adding in your MITO PLEX. And if you're new and you're feeling a little bit overwhelmed by all the information, don't feel overwhelmed. I always tell people to just start. Just start taking 1 sachet of exogenous ketones first thing in the morning on an empty stomach. For people who, if it gives them a little bit of digestive upset, it's okay to have a little bit of food to start, or just decrease your servings. So maybe do half a sachet instead of a full sachet, and then slowly work your way up to a full serving. So that's usually what I would recommend as somebody who is just starting. Again, you can absolutely work up to more. I encourage taking it twice a day, but if you're new, to start with 1 and go from there. I'm not seeing much difference on the scale, but I have a few inches gone. Oh, I love that comment. So thank you for that, Trudy, because many of us are really obsessed with the number on the scale. And the results that you have are actually better, in my opinion. I usually tell women to throw at their scale. And what you want to monitor is body fat percentage. We want to monitor the loss of body fat and the increase of muscle mass. When we're starting to work out, becoming active, building muscle, we'll often lose fat and build muscle. And so your body composition is changing, the inches are changing, but people become very frustrated because the number on the scale hasn't changed. Muscle weighs more than fat, so as you build muscle and lose fat, the number doesn't always change. But if you're noticing that you're losing inches, that's actually my preference, because we know that your body is burning fat. So again, just throw your scale out. I tell people to throw out their scales. I don't own a scale. Throw it out. Go based on how your clothing fits, how you feel, and then check body fat percentage and make that more of your goal in terms of building muscle mass and really just sort of changing our mind frame. So please don't be discouraged that you haven't seen the numbers change on the scale, because the fact that you've lost inches is fantastic. And that's actually generally what we want to see. So throw the scale out. Throw the scale out. You're doing a great job. That's awesome. So please don't be discouraged by those results. That's great. So I'm wearing a heart monitor right now. Is it okay to drink ketones? I think you're referring to a Holter is what you're wearing. It should be fine to drink ketones. You generally want to do what you would normally do in a day when you're wearing a Holter, because you're trying to catch any cardiac, abnormalities. And so it would be fine if you normally drink ketones in your day, then drink ketones. Unless, of course, for some reason your doctor or cardiologist has told you not to, then please don't. Otherwise, do what you normally do, eat, drink the things that you normally do, because it's looking to catch any abnormalities that might occur during your day. I don't know how long you're wearing it for, if it's a 24-hour or if you're wearing it for a few days or not. But yes, I would, unless you've been advised not to, then I would just eat and drink what you normally do, because they're trying to catch to see if something impacts your heart in that way. So absolutely, I would just eat as you normally would. So questions on autoimmune. So I haven't forgotten the lupus question. I am coming back to that. And so somebody is asking, is there any benefit for lupus? And I'm actually just going to wrap that up into addressing just autoimmune in general. So when there's an autoimmune condition underlying, the first thing people are often told is there's no known cause of an autoimmune condition. It's not entirely true. I usually see autoimmune conditions coming after a massive stressor or a hugely stressful event. So someone who's either been chronically stressed most of their life, or there was death, divorce, or really significant sort of trauma. And usually onset of autoimmune symptoms happen after that. But underlying autoimmune are a lot of things that we can address. We can't say we're going to cure an autoimmune condition. But we know that there are underlying factors. So microbiome is an underlying factor that really needs to be managed when there's an autoimmune condition. We know that our immune system stems from the gut. So addressing the health of the gut is essential. We know there's underlying inflammation in an autoimmune condition. We have mitochondrial dysfunction, and we often see low BDNF. So BDNF stands for brain-derived neurotrophic factor. It's something we also see in cognitive decline, and there's actually a gene for that. You can measure it, which is often done in my clinic as well, measuring the gene for BDNF, which is associated, so any sort of abnormalities are associated with cognitive decline and associated with autoimmune. And what they've found is that the best ways to upregulate BDNF are through fasting and through beta-hydroxybutyrate. Both those will upregulate BDNF. Interestingly, for anyone who is of Finnish descent, they are more genetically prone to low BDNF levels. And saunas are also something that really increase BDNF levels. So it's really interesting that that's part of their culture as well, that saunas are really prevalent in that culture. So saunas are really great at upregulating BDNF, fasting, and beta-hydroxybutyrate. So all of those things underlie autoimmune. Mitochondrial dysfunction. We know that beta-hydroxybutyrate has been shown to encourage the production of glutathione. Glutathione is one of our most important antioxidants. It's used by the mitochondria as well to create energy, and BHB has been shown to improve the function of our mitochondria and encourage production of glutathione. And then, of course, we're familiar with the research that we've seen with beta-hydroxybutyrate, the impact it has on inflammatory cascades, and then also the impact that it has on the gut, where it encourages the production of healthy gut bacteria. So there are a lot of underlying factors when there's an autoimmune condition that can be addressed. And when we do that with an autoimmune, it's a lot of work. You're going to be making a lot of dietary and lifestyle changes, a lot of supplements. It's just sort of the nature of an autoimmune condition. But there are a lot of things that you can do to really address those underlying factors and improve your overall health. And beta-hydroxybutyrate has been shown to really impact a lot of those. So there could be some great benefit, but again, it's not going to cure any medical condition, but could be beneficial. Is there a percentage of people who are eating 30 to 50 grams of carbs but are drinking 2 nats a day? So I can't comment if you're asking if they're still losing inches or fat. So I'm not sure if you're not reaching your weight loss goals. So I did touch on that a little bit earlier. If you're eating about 30 to 50 grams of carbs a day and you're taking 2 nats, but you haven't really found any change in fat loss or anything like that, then I would take a look at some of those other factors I mentioned earlier on. So the hormones, microbiome, stress, sleep, all of those things that can really cause some weight gain or impede your weight loss abilities. And then I would also track your food for about 2 weeks, because it sounds like you're pairing your ketones with a ketogenic diet, which is great. And usually that's where you see great benefit when you pair the two together. But as I mentioned earlier as well, often what can happen is we can consume more fat than we often should or we often need. So what I would encourage is that you track your food for about a week or two, and make sure that you're not over consuming the fat as well, because if you're over consuming fats, then you won't see the weight loss goals. Sometimes we do need to bring the fats down. I know in the breakdown of ketogenic diets, we often see you need to consume about 70% fat. I usually have my patients closer to 50 to 60% fat. So I usually bring that fat down a little bit. And usually that's where we see some great benefits. So it might be that you have to lower the fat content, but track your food just to get a better sense of that as well. Are ketones still beneficial to those who have no plans of giving up carbs? Yes, I know we talk a lot about low carbs. Carbs are not the devil. It's all a matter of moderation. I've been keto forever, so I'm obviously on a very low carb diet. Not everybody has to follow a low carb diet. So yes, you can absolutely still get benefit even if you're consuming carbohydrates. That's really the primary benefit of exogenous ketones, is that you can consume them. It'll elevate your blood level as if you're in nutritional ketosis, your blood level of beta hydroxybutyrate as if you're in nutritional ketosis, and your body will still use the ketones. So you still get all the benefits of having ketones in your system, even if you're not following a ketogenic diet. So yes, you'll still get benefit if you're not consuming carbs. But just as a doctor, I'm always, encouraging my patients to sort of follow a more low carb or moderate carb diet. But yes, you can absolutely take it. You can absolutely take it even if you're not making any plans to change the carb content of your diet. So that is all the time I have today. That flew by as always. So as always, I will go through, read through your questions, answer anything that I might have missed. Hopefully you'll be joining me in the reboot this month. As I said, that's available now for purchase. So enjoy the rest of your week and stay healthy, everyone.